Hello, everyone. Today we're here with Dr. Ratul Chatterjee, a family medicine doctor. And today we're just here to ask you a few questions, Dr. Chatterjee. So thank you for joining us today.
Sure, it's a pleasure to be here.
All right. First question. What originally drew you to medicine and what led you into your specialty?
This is a feeling inside that happens. I would say that really for me, it was my grandma who, when the time of 10 or 11, somehow she had a fascination for doctors. And all my uncles and other people were all engineers. So she's like, "You'll be a doctor, you'll be a doctor." From the age of, when I was five, grade six to grade seven. However, in grade ninth or 10th, when I had to do frog dissection and things like that, I hated it. So I said, there's no way I can't become a doctor because I don't like to cut. I don't like anatomy. So how can you become a doctor? So, obstacles come. And then, I thought about being a professor of English literature. I love literature and poetry, or becoming a lawyer because my grandfather is a lawyer and I love rationality and reasoning and being able to communicate. And lo and behold, as I was doing my undergrad, I realized there's this field called internal medicine. By the way, I'm not family practice, I'm internal medicine, which is a little bit different than family practice. It involves a little bit more complex care, and it's mostly for adults only, versus family practice includes kids and pregnant women and all of that. So internal medicine is more complex adult problems. As a undergrad, first year and second year summer, I got an opportunity to shadow one of my friend's uncle, who's an internist, Dr. Shah in Arcadia, and I loved it. For 2 years, every Saturday, Sunday, I would shadow, and it was brilliant. And right there, I think I was 19, and I said, you know what, I want to do medicine because this would be one field where I don't have to do too much anatomy and cutting and probing, which is not what I don't like. But I get to discuss with people just like you guys, face to face, what their problems are, how they're feeling, how can we fix it. All about improving joy and improving quality of care and improving people's achievement on a day to day basis. So the ability to do that by studying science and medicine and applying logic is what drew me there. And I'm practicing for 22 years and I love it today as much as I did the first day.
Yeah, that's great. I think like a lot of people, we've heard about the family aspect. I think it's also great that you found like a really good motivation for it. And I think it's great that you have been practicing for so long and still love it as much as you did. So I think that's great. Yeah.
It's really good
Um,
that you were already shadowing someone else too that made you decide to go into medicine as well. That's what we're trying to do with the Healing Hands mentorship as well.
but what does a typical day look like for you in internal medicine?
Terrible. No, just kidding. I don't look terrible. I'm not trying to scare you guys. It's a good day. You wake up, and before you wake up, your my phone already has patient messages on them, or hospitals and nursing homes calling with situations to be handled. And when you're 29 and you're starting, you feel a little overwhelmed. But over time, you gain traction, you gain knowledge, you gain experience. So a day is a fun day. It's a lot of it is spent working with nurses, working with patients in the hospital or clinic, following CT scans, MRIs, deciding who needs to get what done. COVID changed it a little bit. Telehealth is a reality now. So sometimes, just like I'm Zooming and FaceTiming with you guys, I do that with my patients. So people who can't drive in, I could be doing exactly this at 8:30 in the morning with somebody sipping, having their cup of coffee in their pajamas. And it's nice to have that level of that the formality. I don't like formal. So it's not
Mhm.
formal. It's just a human being who happens to be a patient, another human being who happens to be a doctor. They discuss their day, and then wherever you have solutions to improve longevity, to decrease pain, we do that. And then part of the day is you go to clinic, patients come in. You guys all have been to clinics for situations where you do an examination, you do some lab tests, and you decide what could be the best treatment plan. Perhaps what's the best in the day is the longevity of care in internal medicine, continuity of care. So, it's not like an orthopedic where you see somebody once the ankle fracture is healed, you never see them again. Bye-bye, right? But in our field, all my patients have been with me for 20 years. So it's multi-generational. Grandparents are my patients, kids, parents. It's wonderful.
Wow, nice. That's really cool. Would you say you have a favorite part of the day?
Favorite part of the day is when the patients feel great and they tell me I'm feeling wonderful.
Mm.
That's the really joy feeling, something that money can't buy or a gift or a vacation can't do. It's just a joy to know somebody's feeling improved, and that's really very favorite because that motivates me to work harder.
That's the goal, right? Of medicine?
Yep, that's it. Hmm.
All right. What's one challenge in medicine that people outside the field don't really see?
I think it's probably in two levels. One is at a bureaucratic level. There is a lot of paperwork and things like that, right? You got to do notes. And for me, my patient facing time is very important. So if I have to space even 5 minutes away from the patient doing a note or doing a insurance verification of something, that's something you don't see, but that's not the glamorous part of medicine, but something we got to do. But really, I think for starters, for you students, I think I would say the one challenge is that there is a significant amount of reading and knowledge gathering that one has to do in medicine. And it's not minuscule. It's a lot of reading and good reading. So I would say that's a challenge. The volume is a challenge, of the amount of stuff that needs to be mastered. But when you love a challenge, it doesn't become a problem. It becomes a joy. It's like, well, the more I don't know, the more I want to know. And then suddenly you're not really studying. You're just kind of learning new things. So your perspective changes.
Wow, that's great. Yeah, is that like the main way that you were able to get through like the huge volume of working into a medical school just by seeing it as like a more of a joyful thing than a lot of work?
Exactly, exactly. As soon as you go that it's a chore. Anything you say it's a chore, chores don't work out, right? Nobody likes to do a chore. But if it's the same action or the same job, instead of looking at it as a chore, you look at it as a challenge, as a joyful thing. You can keep doing it for hours without getting fatigued. So the mindset is important. So 100%, I'd say. Then you pick subjects that you like, and if you learn it, you have good mentors who make it interesting. Then it's very joyful. Yes.
Yeah, I completely agree. I think a lot of doctors, that's how they kind of handle medical school. I think that's a good, really good approach. But what advice would you give to students who are interested in medicine, but they don't really know where to start?
Hey, start with your program. Healing Hands and whatever you're calling it. It's a great name, and that's where you start. When you don't know, you check out different things. That's what you do. And as you're checking things out, you're not under any compulsion to think, oh, I got to like this or I got to like this. It's like with an open mind, you go out there and you check out two, three different things. And believe me, the more people go out and check and do things, you end up you know this is what I like and this is what I don't like, and then you go with your instinct. So I would say the same thing like food. If you've never tried any new foods, you just eat the one same thing every day. Well, then you don't know other foods. But once you've tried three, four different foods, your body tells you compared to your brother's or sister's body or cousin's body. You're like, no, I like this. So it becomes very easy, I think. So students who are interested in medicine should go check out different fields and then they'll know whether they like it or not.
Nice analogy. That was really cool. What are some of the most common cases you see on a daily basis?
Most common cases. I'm internal medicine, I'd say. So I have a physician assistant also who will see lots of coughs, colds, back pains. These are common, like, sports injuries, those are common. That's for my physician assistant. My patient population is a little bit more geriatric, a little bit all 65 plus. So a lot of things like heart disease, blockages in the heart, or kidney disease, people who may or may not need dialysis. And how do you figure that out? So we call these chronic conditions, right? Heart disease, kidney disease, blood pressure. That's one aspect that's very common. And the second common thing is, I think, our society is getting disjointed, a lot of internet, a lot of media. So there's a lot of depression and anxiety and psychological issues people are going through today. So I see a lot of that, and I try to make a open environment for people to come in to discuss difficult for them because, in society, we all have fun and it's easy to party somewhere where everybody's happy. But where do you go if you're not happy? So I want that to be an open place, the clinic, where if you're not that happy or you want to sort things out, this is a place you can come and talk about it. So, so that's something pretty common in my office.
Yeah, I think tech has really changed the landscape. I think it's like now a lot of things are less, I guess, human to human. So I think it's really good to have that the open environment because it really helps with the people who may not have a place to go if they don't feel happy all the time. I think it's really changed. Yeah.
Yeah, well said. That's exactly right. And it's amazing how people just relish and somebody who was not doing so well or, feeling on the negative side of things and suddenly starts thriving, and that's awesome. Yeah.
Yeah, exactly. Yeah, I think that's great. Yeah. But I guess speaking of patients, like how many years did it take for you in training to see a patient face to face?
Yes, it's typically, let's say, after high school for internal medicine, my field, it's 11 years. So you finish high school and then you do a bachelor's for 4 years. You can do it in bio, but you could do it in music, you could do it in engineering, whatever you want. But so long as you have the bio prerequisites, that's the first 4 years. Then you take your MCATs, and then med school is 4 years, so that's eight. And everybody, whether you're an eye doctor or a cardiologist or internist, everybody goes through the same med school. And then after that, for me, it was 3 years to do internal medicine residency, where I learned things specific to my field. Versus cardiology could be 6 years or eye doctor could be 5 years. That depends on what specialty you choose. So mine was 11 years total after high school.
What do you do when you're burnt out of your specialty?
When I'm burnt out, I just, that's a funny answer. I never get burnt out. That's it.
Really?
But good question. I mean, I'm sure people can get burnt out. I think, for me personally, I don't get burnt out. I mean, if I was a surgeon, I'd get burnt out. I don't like procedures. So that's why you have to really know before you're going into what you're going into and be able to talk to yourself, and say that this is if this is my passion, this is my field, then you do it. And it's like the World Cup soccer is going on. So, defenders decide to be defenders. Attackers decide to be attackers, right? Not everybody's scoring a goal. Somebody chooses to be a goalkeeper, right? So to attacking footballers, like, what are you doing? Goalkeeping. I want to go shoot the goals. But the goalkeeper has no problems. He has no issues not shooting the goals. He just feels really good protecting their goalpost, right? So same thing in every field. You pick the right field that suits you, then there is less burnout. The one thing that probably burns me out probably is, again, like I said, paperwork, or computers that you're clicking and all of that. That's a burnout. So I use a lot of extra staffing to help me with some of that. So I'm less on my computers doing things and more eye to eye with my patients. And I have some staff who helps me out to put those things in the computer. So my burnout would be EMR, otherwise no burnout.
Yeah, I think that like electronic health records and all that stuff, like all that continuous typing, it gets super hard because it's less time that you have to be able to, talk to the patient. It's more now you just kind of type in their data and it's
Yeah,
just
just like
that's
right. So my eye contact is with you. It's so different, right? Now imagine I had to type the whole time I'm doing like this. So then you didn't
Mhm.
even have to see me. I can't focus on your expressions. And that's something that's really missing in today's medicine. So we have a lot
Mhm.
of technological advances, but the connection is missing. So that's my mission for the next generation, to make sure that as they are excellent in the technological advances, they also know how to connect. And that's kind of my main, I would say, motivation again.
Do you think do you think AI will change the medical field?
Yeah, it has to. AI is all encompassing. So you already in the last 1 year, if there was something I didn't know, even though I'm 20 years in practice, there's so many things you still don't know. So earlier, I had to look up, up to date, which is a subscription based model, or you had to look up big fat books, Harrison's Internal Medicine, to figure that out. And today, you really just type it in, and boom, you got the answer. So, I mean, in a way, it's going to make more, from the good side of things, it's going to get more precise medicine, less mistakes by doctors, in terms of the dosings will be right, and all of that. So we have to keep less junk in our brains because AI will give us that junk. You have to focus more on the concept, not on the junk data. So that's going to be a good side of AI. Bad side of AI would be, hey, maybe none of us have jobs. I'm just kidding. I don't think it'll be that bad. I think in spite of AI, you'll still need doctors so long as you connect.
Yeah, because in the end, that's really the most important part, the connection. I think that's like kind of half the battle in a way.
Yeah, because we're human beings, right? So
Hmm.
no matter how you're introvert, extrovert, doesn't matter. Everybody wants to connect. That's a universal.
Yeah, I agree. Yeah. Well, that's about it. I mean, thank you so much for answering these questions. We really appreciate it.
Thank you, both of you. Best of luck to your endeavors. I'm very proud of the endeavor you guys are starting, and I hope it gets a lot of traction.
Yep. Thank you, Dr. Chatterjee.
Hey everyone, thank you for watching our video. For more information, check out the link in the description at healinghandsmentorship.org. Click the link down below for our student interest form, or click here for more videos.